Good morning, everyone. So we'll just get started with our session. Yep. So here we are. Here are the speakers. So I'll just take a moment to introduce everyone. And I hope you had a good coffee and some good conversations were brewing over the coffee as well. So without any further ado, I would just like to take a moment and say, what are we exactly going to do with this specific session? So here we are talking about something absolutely central to planetary health, which is communications, how we communicate and how we have been communicating. And with that, I would like to introduce myself. I am Nazia Ahmed, Head of Operations, Partnerships, and Programs at the Sunway Center for Planetary Health, Sunway University. And now, after the 2 days of all the conversations and dose of science, policy, planning, programs, we are now turning to the art of storytelling, the spark that turns knowledge into action. Because, let's be honest, we as people, if we don't understand, if we don't communicate planetary health, it would be really difficult to act upon it as well. And with that, I would like to introduce our first speaker, who is Dr. Jaya Sridhar, Senior Health Media Advisor at Internews. Dr. Jaya is a public health physician, a veteran health journalist based in India. With over 20 years of experience, she has trained journalists across Africa and Asia in ethical, impactful health and development reporting. She serves as visiting faculty at the Asian College of Journalism and consults for WHO and Internews. Let me introduce our second speaker for the day, Mr. Oliver Lacey-Hall, who serves as Senior Advisor at the Sunway Center for Planetary Health, Sunway University. Oliver is an humanitarian affairs and communications expert for over 3 decades of experience in the UN, civil society, and government. And he is our senior advisor, and he is the one no, this is not right, this is not right, this is not right. So he is the one who has been taking care of the center from the very beginning. He is one of the founding members of the center as well. Our third speaker for the day is Dr. Cornelia Walter, visiting fellow at Wharton School, University of Pennsylvania. Dr. Cornelia is a humanitarian leader, author, and social transformation expert with over 20 years at the UN, including UNICEF and WPF. She is currently a visiting fellow at the Wharton School AI and Analytics Initiative and collaborates with MindCore and other centers at the University of Pennsylvania. Oh, that's a lot. Okay. I'll move on to my next slide. So here are a couple of resources that are available, and these speakers will be going through in detail, but you can click a picture, you can scan the QR code, and we'll show this slide again later in the session as well. Okay, so how and where did we start it? It all goes back to the work that was initiated right after FAM 2023. Not 2024. 2024 is where we actually launched the roadmap and action plan. It took a long way, and here are all 6 working pillars that we have. And what are we going to really focus on today is the communicating planetary health. There were a couple of requested outputs from the communications working group, from the communications pillar. And I would like to focus on the communication. The first one was communication campaign to raise global awareness. The second was on how do we create a better understanding of the key audiences for planetary health, and how do we have the adaptable materials across all the multiple mediums as well. The third was how do we enhance our outreach. And the fourth and most important was to have a concrete outreach plan and timeline dissemination. Again, with 4 output, we were able to deliver 6. So that's a huge accomplishment for the communications working group, which was led by Oliver again, and a couple of other members as well. Okay, so I'll take you to the session outline, what we are going to focus on today. So the first one is on communications landscape survey, stakeholder mapping and communications playbook, which was led by Internews, and Jaya will be talking more about that. The second one is on the Malaysian National Planetary Health Action Plan, which we also heard from Emeritus Professor Asma on day two during the, on day two. And we'll also focus on what are the communications aspects of the newly established working group on innovation and AI. And the fourth one is the media professional network, training and network. Again, that is something is quite core to the work that we do at the Sunway Center for Planetary Health in partnership with a couple of other organizations as well. And without any further ado, I would like to invite Jaya.
Thanks so much, Nazia, and thanks to Erasmus University and the Sunway Center for Planetary Health and Intent, our founder, for making this study possible. And thanks also to the purple-shirted volunteers, without whom I wouldn't have been able to navigate my way over these last 2 or 3 days. I first off want to say a huge thanks to see this nice turnout here, and I expect a lot of interaction. Because communications, as we know, is an evolving story. We haven't quite figured it out yet. We had a lot of notions about what the communication gaps are like, but it was good to do a solid piece of formative research to try and validate some of our notions about it and to see what else came up. I was struck, as probably many of you might have been, by what Dr. Sam Myers said on day one. He said there's this massive invisible pandemic all around us, and it's just no one is acknowledging it. No one is acting upon it, but how does one respond or act when you don't see it, you don't perceive it? And it took me back to the times, when one was reporting on HIV and AIDS. We used to take journalists to the huge TB hospital in Chennai, which was full of people with HIV and TB. It was easy to report on a massive problem that was spiraling out of control in India. And then when we took that same training initiative to Uttar Pradesh, where there were no hospitals, no one was treating them, there was nothing visible for the journalists to report on. So the epidemic was practically invisible in another state. So I think we have a lot of lessons to learn from global health and from the way we've sort of visibilized earlier pandemics to see if some of those lessons are applicable today. So I thought of it as sort of like a night sky, which is actually full of these warning lights, which are the twinkling stars, but completely obscured by clouds of mis and disinformation. You can't really see what's there. So it's all completely black. And then suddenly there are these fireworks. What are those? Extreme climate events, dizzying levels of air pollution, a pandemic or something like that. And that's when everyone sits up and takes notice and we all start talking about it. There's a buzz. Once the fireworks die down, we don't talk about it anymore. It's the quiet night sky again. And in the distance are those planets, which is biodiversity loss, which we don't even think about. It's so, not discernible at all. So we know by now it's this movement that we're trying to build. And what is this movement about? It's an expression of our desire to demonstrate our interdependence with the planet and its links to human well-being. But how well are we doing that? So our study really sought to explore how is planetary health being communicated today, who is shaping that conversation, and how we can do better. So those were the 3 guiding questions for this global landscape analysis. And till now, there hasn't really been a dedicated global study looking at planetary health as a whole. So between March and September 2025, with funding from Intent and support and guidance from the Sunway Center for Planetary Health Malaysia and the Communications Working Group members, under the Planetary Health Alliance, Internews undertook this global stakeholder communications landscape survey to fill this gap. And we approach this both as a mapping exercise and a listening exercise. And I think many of you who were at the session earlier this morning, it really brought home to us the importance of listening and learning. And I think that session really, I wanted a lot of the sense of humility that I felt at that session, the way I was moved at that session to inform the way I sort of presented today. So we conducted the research in 4 main phases. The first phase was a desk review, where we identified about 96 organizations and individuals across 9 major stakeholder categories. And we drew on Internews' extensive work in health communications to situate Planetary Health within that broader ecosystem. We were also very intentional about one thing. We wanted to really look outside this usual bubble of planetary health conversations, beyond the PHE, beyond the usual high-profile voices that we hear online and in these conferences, to see who else is out there and what are the kinds of conversations that are going on. In phase 2, we conducted in-depth interviews with selected stakeholders in 9 countries, mainly policymakers. We looked at youth advocates, communicators, storytellers, and community leaders on how they perceive planetary health in their contexts. And in phase 3, we did an anonymous global online survey just to identify barriers and facilitators, what they saw as opportunities and again, perceptions. And in phase 4, we did some social media web scraping, primarily looking at YouTube and Instagram, just to see how planetary health online content, whether it's rumors or good information, how do they circulate online. We coded the data using grounded theory and via Atlas TI, and so that the key themes would emerge organically. And we produced 3 major outputs. And we produced 3 major outputs. The first was a narrative analysis with recommendations, and based on that narrative analysis and strategic recommendations, we came up with communication playbooks, which are definitely a more fun read. And each of these playbooks speak to different stakeholder groups, and then also a monitoring and evaluation plan, which you will find tagged onto the back of the playbook, so it's not a separate publication. And what did we find? We found some specific barriers. Firstly, I don't think this list of barriers is going to be a huge surprise for those of us in this room. First, we do know that awareness is uneven, and many communities and institutions lack even a basic understanding of planetary health concepts, including people in the One Health space, by the way. Narratives are fragmented, they continue to remain siloed, they're inconsistent, the way we tell our stories is not consistent. Second, we do know that particularly now, this year, polarization has reached dizzying new heights. So polarization and misinformation and disinformation are impeding progress, with AI amplifying falsehoods faster than we can counter them. And thirdly, as someone else said this morning, our capacity to communicate is also limited because we do rely on vast volunteer networks, many of them with, many of the volunteers having very little training or capacity in strategic communications. And these are sort of amplified by technological and access barriers, which means that we're not hearing enough of a rural conversation, enough of rural conversations in this mix, or enough of the voices of marginalized groups, people who are purposefully disengaged from this conversation and left out. They're not part of it, they're not teaching us, we're not learning from them. And these barriers together don't just limit reach, it's not just all talk, they're shaping the fundamental way planetary health is being understood and how it's being acted upon. But the situation isn't all bleak. These are some of the facilitators that emerged. These are pretty powerful. The first thing is, and I think this also came across this morning, if we can find a way to talk about how we reground our ideologies and how we deepen our connection to place, that can lead to a sort of a societal level change in a much larger way. So again, we're talking about philosophy, different ways of living, thinking, relating to the earth and being. Easier said than done, but I think there is enough of an impetus here to start with. We need storytelling that goes beyond data. We need stories that grip public imagination. We're really talking about making them very relatable and infusing them with emotion as well as evidence. The stories need to be localized. They need to be simple to understand so that they are relatable to audiences. They need to be in local languages, using local metaphors that people can relate to culturally in order to make sense. And of course, this is another really important finding that, and this has been talked about again, solutions framing works far better than something that says, this is a polycrisis, which is a paralyzing way to start telling the story of planetary health. So very practical, focused messaging, that links a planetary health diet with an absolutely practical recipe that you can immediately try at home is likely to sort of permeate and be far more actionable. So making it tangible is really key. And across the data, 4 main priority audiences, consistently emerged. Policymakers, number 1, no surprise. Youth, young people, number 2, again, no surprise. And business sector, the private companies, again, and disengaged individuals, deprived, disengaged, marginalized communities. These were 4 priority audiences. So based on these findings, we developed a set of strategies, communication strategies, to turn all of these insights into action. So we distilled the findings down to 7 strategic recommendations, which are applicable across the stakeholders. Make the communication real and relevant to daily life, and tell value-driven stories that are grounded in universal shared values. Localize the message and ground communication in local culture, local pride. Lift up trusted voices, and whose voices? It's farmers, it's faith leaders, it's indigenous leaders, it's youth, it's community figures that wield enormous influence and trust. And note, I'm not putting health professionals first or scientists first. It's us that are dominating the conversation, and we really need to take this chatter outside academic journals and outside the conference rooms, to the streets. We need to build trust through networks, through informal community networks like education, like schools, health organizations, youth groups. We heard from Teddy this morning. It was wonderful to hear. We need to balance clarity with creativity through arts and lived experience. There was Tobile this morning talking about that. There's so many ways to tell our stories and make it as participative as possible. And again, we need to have a judicious blend of online and offline formats for the widest and most effective reach. So these 7 strategic principles basically are the intellectual backbone of our playbooks for each stakeholder category. And who are these stakeholders? We've developed the playbooks to engage policymakers, business actors, young people, indigenous communities and /civil society, faith representatives, social media influencers, academicians and researchers, and health professionals. So why does all this matter? I mean, essentially, communications is not a side activity. It's not like, the advocacy pillar as such, but it's something which is far more foundational. It can, that's what needs to go hand in hand with every other thing that we do. And the transformation is possible only when communication is organically linked to opportunity, to cultural nudges, to political nudges, to, it has to be emotionally resonant and plug into belief systems that actually drive action on the ground. So we've we recommend conversations, that conversations need to happen at two broad buckets, if you like. The first is advocacy, as we know it, very familiar. Those of us working in global health very familiar with this. So it's strategic communication, which builds targeted stakeholder support and public support for specific planetary health action. And the other kind of communication, which is even just as important, if not more, is democratic communications, which is broad awareness building, which normalizes planetary health in daily conversations, whether it's through the media or through online conversations, so that it builds evidence-based and open science-based dialogue and builds a scientific temper so that we can relate to what's happening to us far better. We propose 6 cross-cutting principles for any planetary health communication strategy. And again, these are just things that have come out of this preliminary piece of research, and this is all open. And we invite you all to strengthen and add your ideas and thoughts to these. We do know that equity and power, again, we've heard it at practically every session. We need genuine co-leadership from historically and for historically marginalized groups. We need to learn from them more than the other way around. We need narrative coherence so that there's one unifying storyline that can unite rather than divide. We need integrated conversations across groups. We need journalists to sit side by side with researchers, faith leaders to sit side by side with journalists. We really need to bring all of these diverse stakeholders together in conversations. We need to anticipate risk. How do we counter greenwashing? misinformation? How do we counter polarization through pre-bunking or through building a cadre, maybe like a speakers bureau of trusted messengers who are really good at this? I was just joking with Oliver yesterday. We do need an insurance salesman in the communications working group to sell some of these ideas. And context-sensitive messages, again, adapted to local media cultures that speak the local language, the local lingo, that can reflect local governance and local traditions. And of course, we need to measure what matters, outputs and outcomes over time, and get those trends in place so that we can make this an iterative exercise. So supporting the playbooks, we have 3 broad, again, cross-cutting context notes, and we'll be adding a 4th one on AI pretty soon to these. The first is a context note on building information integrity. And the second is one on building systems thinking across all of the communication strategies. And the third is turning evidence into advocacy. So these are all, again, coming from a lot of work that has been done by several organizations on the ground. And these are what the context notes look like as a sample. And watch out for the next, for the one on AI. And the tailored content in each of the playbooks spans out across these 9 different elements. So be clear about the mission, what is your communication objective. Build your network of influence, who are the best people to partner with as you launch and develop these communication strategies. Have a clear understanding of exactly how you want to play the stakeholder group, which levers you want to press to achieve what. Choose the right messengers to speak to that group. I mean, business actors are not probably going to listen to journalists unless it affects their image or their bottom line in some way, for instance. We need to deliver messages that land, that resonate with the motivations or with the bottom line of that group. Keep that door open, build relationships. A single message doesn't change hearts and minds overnight. We have to start building, not going in there as Professor Jamila said, saying, I have a nightmare, but offering value. Offering value, for instance, if a policymaker is dealing with a flood situation, in my hometown of Chennai city, that's the time to sort of give him some information, talking about how that's linked to climate change and offering to help. Choose the right messengers to talk to these people, time it right, as I said, and track and prove the success of embedded communications over time. And we have case studies to support each of these stakeholder playbooks as well. And I think this is the most important part that I will conclude with. It's that we really need to have a good, sound sort of set of actions to monitor and evaluate what we're doing. We haven't done this in a systematic fashion in the planetary health space, I believe. There's lots and lots of experience we can learn from the world of global health and now One Health as well, that we can bring to this space. But these are the broad, it's a very broad, basic, simple M&E plan structured in quarterly phases that will sort of run out, that plays out over a year. And I just want to end by saying communications is all very well, but as we know, they're just the first link in a very, very long sort of a chain of change. And we can use communication to spark conversations, inspire action. But really, transformation happens when the communication is viscerally, when it's organically linked to policy, when it's linked to programs, financing, community initiatives. And these playbooks, they offer a set of what we fondly imagine are very sharp tools. They're very practical, as you will see, and we look forward to your feedback. So they sharpen our tools at the communication stage. But how we link this work to governance and collective action is really where the rubber hits the road. So this is just a sort of a start. It's just the first step of building a global planetary health communication strategy. And it's offering ways to blend evidence with emotion, with storytelling that grips public imagination, that is infused with fairness and equity and compassion, some moisture, and also some fresh ideas and innovation to inspire transformations. And we do believe that this is the magic mix that can take us forward on this journey. It's an adventure. It's going to be iterative, but unless you all, our appeal to us from the group is, unless you try these playbooks out and give us feedback on how this is working And it's going to be a living online document, and we look forward to making this a very organic process as we move forward. So thank you very much for your attention, and I'll hand to Oliver now.
That's the right height now. Jaya, thank you very much indeed for that. It was a real pleasure to work with Internews on this very exciting report. It was done in a very short period of time. As Jaya said, we're open to review and so on and so forth. But I guess from my perspective, now that we have this evidence and we have this playbook framework, the question is, where do we test it, how do we apply it, and so on and so forth. You will remember that on Tuesday, the head of the Academy of Sciences of Malaysia stood up and said, here's our plan. That plan includes a relatively ambitious communications and behavior change element. So what we would like to do is take the playbooks that we're using here and test those against the Malaysia plan. So let me just talk a little bit about that plan. This, there we go. This I don't need to repeat because it was much more brilliantly presented by Professor Asma on Tuesday. But just a kind of a brief recapitulation of why Malaysia has gone down this pathway of putting into place a national planetary health action plan, what it is, the principles, the 6 priorities, the fact that there is a kind of new logic underpinning how you make government, society, and so on and so forth come together at all levels. And what the goal is, which is to embed planetary health into policy and daily life for a resilient, fair, and prosperous country. And of course, the key element of that is it's all very well sitting and discussing that in a hall like this, but there are 36 million Malaysians out there who need to understand what it is that the government is trying to do, that it is in their best interests. So, of course, as a part of the preparation for the plan, quite a lot of surveying and research was done to figure out, where are we? And 2 or 3 findings came back very clearly. One, big plans fail if people are not able to connect with them. Number 2, that whatever you're trying to do, or whatever has been done in the past, you tend to find the messages are scattered. Different ministries put out different messages and so on and so forth, so there has to be a unification of messages. And that communication, anything that we communicate has to link planetary health to people's everyday lives. If it doesn't, we get really stuck. People don't understand, why this is important and why it's relevant to their lives. So what the National Planetary Health Action Plan is trying to do is basically kind of build a shared national, a shared national story where, there's an articulation of the fact that we need to care for people and planet in order for us all to live healthy lives. Secondly, that the messages that we put out have to be simple. They have to be relatively positive, and they have to encourage action. That we have joined up campaigns across government, across media, schools, and so on and so forth. That there's a coherence across those plans, which I think is exactly one of the key findings of the Internews study. And that, as part of that process, and thank you very much indeed to the speakers in the previous session, because that was really, it was very moving, and it was very important that those messages came across, particularly around listening. So engaging local voices, communities, youth, faith leaders, and so on and so forth have to be included in any messaging that is done or any communications that is done. And fourthly, and it's a real shame that that session is taking place at the same time as this one, because I'd love to be in that session, but business, the economy, it's really important that the values that are being put forward in this plan are communicated clearly to business, and business understands that we're not saying you can't continue to make profit, but that there are better ways in which you can do that. So there is a communication toolkit. It was developed around about the same time as the Internews study was being put together. So we now need to go back and look at that and see how the playbooks can help us with the implementation of that plan. But the focus is on inspiring stories, connecting clean air, safe food, green jobs to better lives, using kind of the power of the structure that Asma described, that Professor Asma described the other day, that you've basically got this process being led by the head of government, and you can therefore kind of pull on the various levers around media and communications and so on and so forth, TV, social media, not controlled by government, but you can definitely have an impact there. Schools, workplaces, and so on and so forth, using trusted voices, voices that people, they know and they already follow and can engage with, and visible signals, giving people awards, recognition for sustainable action, and so on and so forth, and making sure that there's a really clear feedback loop that people can engage with. I think, the link between that and what we've been trying to do at the global level, hopefully is relatively clear. The National Planetary Health Action Plan has a working group focusing on values, culture, behavior change, and communications, which is led by Jamila Mahmood, who you also heard speaking on Tuesday. And believe me that she and Professor Asma are quite a team when they get together and decide that things need to happen. So I think, we hopefully have an articulation where the Internews report, what we're doing with the National Planetary Health Action Plan in Malaysia, gives some visibility and relatability to how you, quote unquote, do planetary health communications, or communications for planetary health, perhaps more accurately. The aim is that we translate some of the, abstract is perhaps too strong a word, but some of the really good and solid ideas that we all have into action. And that's kind of, I think, what we want to do. So I think the takeaway for us here at FAM 2025 is not to say, please, oh good, Malaysia's going to do this and then we can all sort of figure out what to do later, but to see Malaysia as a kind of lab that we can all learn from. But that doesn't, I think, stop anybody in this room taking these reports away, reading them, looking at the playbooks and starting to think, as we heard in the previous session, what role do I play? How can I be involved in supporting effective communications of planetary health? We all have neighbors, we all have constituents, we all have workplaces. Looking at what those playbooks provide to talk to your neighbors, your workplaces, others, to work as advocates and so on and so forth, I think are going to be helpful for all of us. Drilling down a tiny bit more, we've started to focus already on one of the groups that is mentioned or that is one of the playbook areas that's focused on in the Internews report, and that's really around trying to figure out how to get the media on board. And I think what we did some thinking about this, and what we discovered was that when you talk to most journalists about planetary health, they don't really understand what you're talking about. Luckily, we were able to get a little bit of funding, and we have run, since FAM 2024, we actually did the first one in the margins of FAM 2024, which, as organizers of FAM 2024, was a totally mad thing to do. But we did it. We brought 30 journalists together and sat them down and said, let's talk planetary health for 2 days. We've done 4 more sessions from then. We have learned from each of those sessions. If you look in the QR code, you'll see the reports from the first 3 workshops we did this year. The 4th one will be produced shortly after this. But basically, we've tried to kind of break down some of the key issues that journalists are reporting on, to give them planetary health frame, and to provide people with a 2-day, fairly intense, well, very intense training, simulation exercise experience in Malaysia. As you can see from the slide, we did the pilot in the margins of FAM 2024. We did the first one this year on the issue of planetary health and heat, the second one on air and plastic pollution and health, and the third one on intergovernmental processes, which was in September, just before kind of the UN Climate Week, the COPs, and so on and so forth, came together to help journalists understand how those processes work. Some of them do, but many of them don't. And trying to get them to help them to understand text and the relationships between the various events has been really important. We've trained 120 journalists. We thought if we trained journalists for 2 days and sent them away, they'd be happy. The evaluations that we did at the end of each of those sessions made it very clear, no. We need you to help us connect with each other and stay connected to each other. So we have established a Asia-Pacific journalists network for planetary health, and I'll talk a little bit more about that in a second. In fact, I'll talk about that now. So the media professionals workshop, so we've done, as I say, the 4 workshops. There are four key components to the network. One is a real simple Google Drive, where we're putting reports, information, including reports generated by people who've been trained in previous cohorts into a Google Drive, so everybody has access to those. We have a WhatsApp chat called Asia Climate Chat, 130 people. Starting to get really active now, with journalists having conversations with each other, asking each other for resources. You know, if there's a situation like the flooding that we had in Bali a few weeks ago, you've got journalists from other regions saying, what's going on? Can you tell us a bit more about this so that they can report on it? We're going to start running a series of webinars in virtual cafes, so that group, this bigger group of 130, which will become 160 by January next year, and will keep on increasing, can come back and we can have webinars on things of common interest. And we're going to put in place a website for them, a kind of closed website to put all of these resources into as we go forward. But our sense here is for this one group of stakeholders, the playbook is going to be really useful in figuring out how we improve the way in which we're supporting with them and communicating with them. So that, I think, is sort of where we're at. Our checklist as we go forward is to continue the workshop series and to focus on the specific themes. The next one is going to be in the end of January next year, where we're going to take a deep dive into misinformation and disinformation. The network, I think, is set up. I think our ask to you as the communications working group is this stuff expandable to other parts of the world? The media training, we think, is really important. We're trying to find out who else might be doing this stuff. There are 3 or 4 organizations around the world, and we're keen to link up with them. We have a methodology, we have reports, we have lessons learned, which are probably applicable to a certain extent to other regions, and we'd be delighted to share that with other parts of the world. And the same with the Media Professionals Network. It doesn't need to be a South and Southeast Asia only Media Professionals Network. We can scale that, we can expand it. We have a dedicated staff member who can work to bring this together. So it's pretty cost neutral. The workshops, unfortunately, are not cost neutral at all, because we're bringing people in. We recognize the importance of having people in a room together and communicating and networking with each other. And I guess the final thing from our side is we recognize the need to make sure that our impact metrics are stronger than they are right now. You'll see that from the lessons learned reports that are included online. I think that's it from me. It will be great during the discussion to hear from people who are keen to think about whether we can take this to other regions. We'd be really keen to work on that with you as part of the communications working group. My last plea is, we started off with 35 people in the communications working group, which was great. We've kind of fallen down to about a dozen. It will be great if people are interested in signing up and joining us and working alongside us as we try and take this very ambitious agenda forward. Thank you.
Well, now you learned everything about communication, so there's nothing much to say, but AI. AI is right now this cool kid on the block that everybody is thinking and talking about. This, in a snapshot, is what I'm going to talk about briefly, pro-social AI. And just maybe one thing, we're not going to go into any kind of technological details, but AI has been around for decades. It has exploded, however, onto the scene with the launch of ChatGPT in November 2022. And it's only this type of generative AI that I'm going to focus on. And what you currently see on the screen is the logic that underpins pro-social AI, which I'll get more to in a second. Social change is the cause and consequence of individual change, and natural intelligence is the cause of artificial intelligence. What we need to make sure is that it does not become its consequence. We're currently navigating a very dangerous transition. And there are 4 underappreciated issues of AI that get much less attention than the hype of efficiency and effectiveness, but also it gets less attention than the doomsday scenarios that you probably all have come across. So let's go one by one, and one could name that the ABCD of underappreciated AI issues. The A of agency decay. We have passed the stage of experimenting with AI. Maybe we can just have a quick show of hand. Who has not yet tried ChatGPT, Gemini, Claude, or anything else? Anyone? Okay. Who is using it every day? So I think the majority is now becoming a quite seasoned user. So we're into the stage of integration. Now, the next stage is going to be reliance, where all of a sudden it's becoming also cumbersome to writing our emails ourselves, to doing our calendar appointments ourselves. I don't know about you, I did not have a cell phone when I was a child. I still remember the phone number of my grandmother when I was 5 years old. Today, I barely remember my own. Google Maps. When did any of you last time use a real map on paper? Most of us are looking on our phones like we're looking for water, like people in the past when we're trying to find a destination. Well, these are punctual functions in the brain. They're secluded areas in our wiring. But ChatGPT is this general purpose technology. And human beings, what they are, we like to offload effort. And in particular, cognitive effort. We embrace every opportunity. Now, tools like ChatGPT are fantastic, but they are also really dangerous. We are part of the last analog generation. We had the luxury that our brains had to evolve against friction. And let's face it, the brain is a muscle. Use it or lose it. Now, what about the next generation that will grow up with ChatGPT on their fingertips? The education system is not ready for that. But that leaves us, as this last generation, with a responsibility and an obligation to make sure that the systemic setup is ready for those who follow us and gives them a fair chance to have their brain potential developed. The B of want erosion. AI companionship is becoming ever more all-pervasive. Probably you all read about stories with people falling in love with their chatbots. Well, if you can have something on your fingertips that tells you what you want to hear, speaks the way you want to hear it, is always available, always friendly, always patient, and that in a couple of years might be embodied in a really beautiful robot, why would you bother with another quirky being that is just as cumbersome as you are yourself? The C of climate change. There is still very little data available about the environmental footprint of AI. There are some informations coming out here and there that an individual prompt on ChatGPT uses as much as 9 seconds on Netflix. But what about the training of the large language model? What about the land use for the data centers? What about the water use for the cooling of those centers? There are a lot of very uncomfortable questions when it comes to the climate implications of AI, and not enough of these questions are being asked. And finally, the divided society. Amongst all the excitement about AI, it's important to remember that although there are millions that are using ChatGPT, there are billions who are still struggling to have clean water, electricity, and 3 meals a day. And as we're getting ever more excited about our technological treasure chest, maybe we should think first about using those treasures to help those who benefit the least and need it the most. So, the time to shift the needle is now, and it involves all of us. We're navigating a dangerous tipping zone where 4 points are pushing each other. At the individual level, we have agency decay. People are feeling disempowered, both about this AI swipe that seems to engulf us, but also about what's happening to the planet. It seems to be happening out there, this big something, and we're watching it helplessly, and we can't do anything about it because we feel so small. At the meso level, institutions are rushing to jump onto the AI train, trying to be part of it and not to be left behind. So AI mainstreaming without little knowledge about the consequences, just to be part of it. At the macro level, nations are rushing towards AI supremacy, the holy grail of artificial general intelligence, although nobody really knows how we will control those systems once we have them, including OpenAI and Google, which are very transparent about the fact that they don't know. They want it at all price, but they don't know how they will manage it when they have it. And finally, at the meta level, we have ever more planetary boundaries that are being crossed. 7 out of 9 with irreversible consequences. The coincidence of those 4 tipping points is not promising. But there's something we can do about it. Because individual change, social change, technological transformation, and planetary change, they are part of one interconnected system. We cannot think about one without thinking about the others in a hybrid society. But that means addressing one gives us entry points to addressing the others, which leads us to pro-social AI. AI, at the end of the day, simplified said, is neutral. It's a tool to an end, and that end must be determined by us. Because the old saying, garbage in, garbage out, still holds true. And we have a choice. We can make that values in, values out. Pro-social AI systems refers to AI systems that are tailored, trained, tested, and targeted to bring out the best in and for people and planet. In a way, you will say, very simple, well, it's not how technology has been driven during the first, second, and third industrial revolution, where AI was driven by commercial interests. Well, AI has such far-reaching consequences on the way we think, we feel, we perceive ourselves and others, how we interact. We can't leave that in the hands of the private sector alone. We must play a role as citizens, as civil society, as governments, as faith-based organizations. Everyone has a role to play. This is not something that can be delegated. But that requires agency. Agency being defined as the ability and the volition to act and the perception of that ability. That, in a hybrid world, requires HI, hybrid intelligence, which arises from the complementarity of AI and NI, so artificial and natural intelligence. Because to use both of them, we need to understand both of them, their weaknesses and their strengths. And that requires double literacy, meaning human literacy, a holistic understanding of self and society, people and planet, and algorithmic literacy, not just prompt engineering and how you use the latest tool, but also what are the risks, what are the limitations, and how does it impact you and your own thinking. So the current rush towards AI literacy is not enough. Now, how does this matter when we think about the roadmap that was presented? It helps us to curate a mindset of power, of agency. It combines two of the most pressing issues of our times, planetary change and technological transformation, and it leverages priorities, people, profitability, and planetary implications. So it is a way of re-injecting urgency into the planetary health agenda, because AI is this new something that everybody is excited about. Why not use that when we communicate about planetary health? The AI working group, which everybody is welcome, and we have the next session at the end of this month, so please, no matter if you are an expert or if you are a newcomer, everybody is welcome. We are all learners on this lifelong journey of AI, which nobody knows is going somewhere. But we all need to be part of it. So please join us, and if you're interested, send us a message, and yeah. So we have relatively recently only joined 3 months ago, but have been productive. And you can see the results of that via the QR link. So there's a statement of intent, and I'm very grateful to everybody in the working group, both of those who are offline and online, because there is a real appetite and a real commitment to take this to a stage where the Planetary Health Alliance has a voice when it comes to AI. And that will be important as we're moving forward. So we have a briefing note, we have a work plan, we have terms of reference, and moving forward, the question will be to do a stakeholder mapping, to develop operational principles, develop case studies, and to build alliances with like-minded thinkers and practitioners. And I can't overstate that. Everybody is welcome. And that's it from my side.
Thank you, Cornelia. And I would like to share this slide here again with all the resources. Make sure you have a picture of it. You can go back and reflect on it. And with that, we move to next segment, which is the discussion. And I already see we have a couple of questions already here. Just give me a minute. Yep. Okay. So I'll take this first question, and it's open to all. What is the standardized planetary health message we should all coordinate on? And what are the key points or words? Okay, you have the mic.
Yeah, that's not an easy one. So we need to be more strategic about this. So it depends on what you want to achieve, which is the specific action that you want to achieve. As we know, this is a huge, multi-layered, complex issue. And if you are after a particular policy action or a particular something that you want the health professional to do in your community, but that's how we need to structure the message to achieve that objective. So there's no single broad planetary health message. If we go out there to say it's a polycrisis and we need to act with urgency and agency and all of that, it's a bit too abstract. So as we've learned, make it real, relevant, relatable, and culturally resonant. So it's up to each of us to sort of create what we want to achieve. So always have the end goal in mind and then come up with a message.
So, I mean, from my side, it goes back a little bit to my plea at the end of what I said, which is we need more people from around the planet engaged in this discussion. Because you're absolutely right. You know, identifying what is the core message, what are we trying to tell people, is not something that I can decide or Jaya can decide, or the Internews report can tell us. It needs to be a collective endeavor, and it's probably going to change over time. So if we're talking about a kind of a way of trying to communicate across the planet on what planetary health priorities are, number one, those need to be contextual. Those messages need to be contextualized. They will differ from place to place, but they need to be underpinned by a kind of core understanding of what our overall communications goal is. And I don't think we're there yet on that, and I don't think you can rely on a dozen people sitting on a Teams call once a month to decide that, quote unquote, for you. We need more people in that conversation. That's difficult. It's difficult to manage larger conversations. But for me, we need to have more people in that group. We need to be more joined up about understanding what it is that we are trying to say, how we're trying to say it. And there, I think, if you take time to look at the playbooks are a very deliberate way of saying, if you're talking to a policymaker, it's a very different way of communicating a message than it is to a journalist. And that, I think, is really important. Those core messages are going to need to be adapted per audience. They're going to be adapted in the way that they are communicated, in the way that people receive those messages. So my plea is, please, can we have more people in the room helping us to figure this out? Thank you.
You don't need to choose between the working group on AI or communication.
If I can just add 2 words here, would be interconnectedness. Again, we have to understand planetary health is human health as well. And the second word would be, for me, is urgency. And that is all what we have been talking about at FAM 2025 as well. And with that, I move on to my next question, which is specifically for Oliver. Was there as much of a backlash in Malaysia to the action plan as there has been in Europe to the Green Deal? And if not, why? What did you get it right?
Wow. So I think there are probably 3 things I would say in response to that. 1, you were the first people to get a briefing on this.
Yes.
This has not been briefed to the general public in Malaysia. They were really, really keen to come here. It was very interesting. I had a conversation with Prof. Asma yesterday morning. I said, you did a brilliant job. And she said, I was terrified. She said, I couldn't make the tech work. And I said, well, you didn't come across as terrified. You came across as very, very confident, and I think left us all with a tremendous sort of feeling of uplift. So the plan has been through Cabinet. The plan has been consulted with Parliament. There have been a massive series of consultations with individual stakeholder groups. The actual rollout of the plan and its presentation and its publication takes place next month, which is why you only saw the executive summary. So I don't think we're there yet in terms of understanding whether there will be a quote-unquote backlash. I don't think there will be a backlash because I think Malaysian society operates in quite a different way. There was a lot of, I'm trying to think of the right word. There was a lot of very lively debate and discussion amongst the 400 or 500 people who were in, and Kennedy, you may want to add on this, but the 400 or 500 people who were involved across the, however, 6, 7 working groups with representatives right the way across from society. And there was a lot of very active discussion and a lot of warning about the fact that this was going to be difficult. Where I think we have to be positive and upbeat is that despite the fact that there are perceived difficulties around this, there are a group of stakeholders in Malaysia who are very clear that this needs to happen. And they include politicians, they include civil society actors, they include faith leaders, they include business people. That the kind of business as usual, the statistics show that business as usual isn't going to work for Malaysia anymore. And let's remember that Malaysia is a petrochemical state, so they're looking at their future and figuring out what do we do 20 years from now when nobody wants to buy fossil fuels anymore. So there's a double pressure for the country. Maybe
you also want to share how much time did it take to have the planetary health action plan?
The process started 2.5 years ago. And I'm not saying that it started 2.5 years ago and everyone kind of sat in a room, but there has been a series of extremely active conversations that took place over those 2.5 years. A lot of debates, a lot of fighting over language that should or should not be not fighting, but a lot of debate and very active debate and discussion about what language should and should not be in that overall plan. I'm very excited to see the full plan, which is about 200 pages long, as I understand, when it comes out, because it's detailed, it's comprehensive, and it's politically grounded.
Thank you. Okay, one more interesting question. Maybe this can be answered by Jaya. How to communicate with people that are non-believers of climate change? What could be a question to ask them? What stories will be best to tell them?
Well, yeah, a range of stories, I think. And I think the timing is really important. As I said, approach a climate non-believer policymaker at a time when the city is underwater. That's a good time to talk to them. And pair it up with a policy brief and evidence and so on. Mobilize young people to talk about planetary health changes, the transgression of planetary boundaries at times like that. So we really have to hit those levers when climate change is at the top of your mind. So otherwise people can't take the strain of a planet crumbling under your feet and it's largely invisible while you're trying to get to work and meet a deadline or something like that, which is why it can be a very depressing, deadening sort of a reality that we live in, and this whole polycrisis framing may not really cut ice. So I think we have to, which is why there's no single unified message as such. I think we each have to innovate depending on the opportunity that we see. But being tuned into the reality of planetary ill health, that invisibility of it, and the moment there's a bit of visibility, but that's the moment to strike, and then those stories will all get joined up, I think. So non-believers, yeah, that's the time to talk to them with evidence, and then go with them, walk hand in hand with them to help them sort through it, rather than just say X to their Y or something like that. So we have to find what appeals to them and then have the conversation. I think beginning the conversation with them is a good place to start.
Okay. Thank you.
I don't know if I should say it, but I'm going to say it. It's in the manual. It's in the manual. Look at the playbook. You'll see the notes. One of which is on misinformation and disinformation, and it basically helps you to understand how do you counter this kind of stuff. And it's exactly what Jaya said. Find the right moment to quote unquote strike.
Okay.
Can I add to that? There's ways you can look at it, the supply side and the demand side. So one of the ways is to reduce the supply of mis and disinformation. And you can do that by training journalists, for instance, not to put out the wrong narratives in their publications. There's ways to talk to faith leaders to make sure that you replace falsehoods about climate change with the right information, so you can supplant rumors with good information. You can do some pre-bunking and things like that. We also need to work with the large tech giants to see. I mean, I'm talking at a time when just a few months ago, Facebook just dismantled their entire fact-check strategy. So it's how we're going to work around that, and with AI on the in the picture, it's just going to get worse. So we'll need to quickly find ways to use it as a force to counter mis and disinformation. The best way to do it is not to repeat the rumors and the myths, but to replace it with good information. So that's the dominant sort of story out there.
Okay, thank you. So there are a couple of questions coming in on AI as well. So I'll merge two questions for you, Cornelia. So AI is consuming so much energy. How can we justify the use of more energy than can be generated? And the second part of this question here is, how familiar are you with indigenous approaches to AI?
Thank you very much. They are both very good questions, and I have only partial answers to that. So the first one, as we're waiting, and I think the world is looking into the actual energy implications of AI, there are two very pragmatic things to be done about that as an individual user, which is A, be careful and be an informed consumer about when are you using it, and really think about, do you really need it? Because sometimes we just go the path of least resistance. Maybe all of you have experimented with generating images. Well, maybe it's not necessary to do 500 images until the rabbit smiles the way you want it. So it's a question of being deliberate about what we do with it. That's number one. The second one is to be transparent. I think it is fair to have questions and to have answers, knowing that they are not perfect. Whether as individuals or as institutions, the main point I think that each of us can do is to push for more transparency and to look at some of the white elephants in the room that come from the AI discussion. Rather than using it and not talking about it and not talking about the implications, if we decide to use it, then let's be transparent about why, after weighting the pro and contra, we decided to go for it. And the second one about indigenous use of it, actually I wrote 2 articles which you can find on Forbes about that, because I was fortunate to organize a session with indigenous leaders under MIT last year, where there are some very interesting examples of indigenous knowledge being used to train large language models. And there needs to be more of that, and there can be more of that. And actually, it's one of those illustrations where the best of local and global can come together to come up with global magic. And that's the kind of path towards AI, towards pro-social AI, that could be very valuable. But for that, we need to get indigenous voices into the room. We can't leave it in the hands of Google, OpenAI, and Anthropic to make those choices and consider that, oh, they're happening to us. But again, this is where a forum like this and the regional hubs and each of you matters. Because where you are one step closer towards bringing the voices that matter into the room.
I'd only add one point, which is that this morning over breakfast I was leafing through the newspaper and there was an article on the fact that some countries are trying to develop their own generative AI models, and you can speak far more coherently about this than I do. Singapore, Malaysia, in Southeast Asia, and other countries are basically looking at developing their own large language models. The last line of the article was, the problem is that if you go and talk to a kid sitting in Kuala Lumpur, are they going to use the domestic one or ChatGPT? And that, I think, sort of resonates with what Cornelia is saying. It basically comes back to our own individual behaviors and the way in which we're trying to influence where this goes and how it goes, and the importance of this sort of conceptual pro-social AI rather than the AI for profit that we're seeing right now. The significance of the working group and the working group coming up with standards and so on and so forth. This has to be the start of the way in which we try and build some kind of movement that counteracts what's going on, in the same way that we're doing on sort of broader planetary health narrative.
Okay, thank you. So as I mentioned earlier, that it will be an interactive session. So why only you ask the question? Now we have some questions for you. Yeah. So probably from the audience, you can take an opportunity to look at the questions and feel free to share. Because again, we are reiterating what Oliver mentioned again. It cannot be done, but only a few people in the room. Everyone's energy here matters, and yes, that is what we want to hear from you as well. So the first question here is, how can we revitalize the communications working group? Currently 15 members, so anyone who would want to volunteer or think that, okay, my specific organization or someone I know would be interested to join. Okay.
Great.
Yeah,
Can we just get a show of hands? That would be really helpful. Who's interested in joining? Yay. Thank you. Just a warning for those of you who are on the east coast of the US or in Asia, it means a call at like 7 o'clock in the morning or 8 o'clock in the evening. And believe me, I've done enough of these. But if we can get a larger number of people into that group to help us think through where we go next, that would be great. The grunt work is done. Now it's the conceptual stuff. Now it's the agreeing the messages. Now it's figuring out how we take this to scale. So at the end, will put up my email address.
Yep.
And if you can just send me an email, that will be
And
great.
I have seen the faces of people who raised their hands, so I'll make sure to come after you. Okay, so our second question here is there an appetite to develop outreach and dissemination plans for the playbooks and M&E framework? There was also a question in the on the Slido, which was referring to this, so yeah.
How many of you have seen the playbooks?
Because they were circulated to everybody before the conference. I mean, my sense would be to recognize the significance of what Internews has done here, which is, I think, for the first time to say, here are the voices, understand what the voices are saying, which I think we've tried to do. Here are the barriers, here are the opportunities, here's the manual. And if you don't manage to read the research report, you can read the manual independently. The research report is big and heavy, but as far as I'm concerned, it's a joy to read because it gives us so much evidence. But if you don't have time to read that, please take the playbooks, look at the monitoring and evaluation framework and start to think through how can I apply this in the context of my organization, my neighborhood, my sphere of influence.
We promise they're fun.
Yeah, they are fun. They're pretty.
Okay, so next question on the journalist training. So as Oliver mentioned earlier, it does take resources and time. And considering that, is there an interest in expanding the journalist network beyond South and Southeast Asia? I'm jumping to question number 4 before coming to 3rd. So is there an appetite? Do you think that this would be something that you would want to take to your region? And we are certainly here to help, to assist what exactly and how we have been doing in the region. Yes.
Would you like to speak? You've got your hand up. You want to say something? No? Okay. You had your hand up. You like to say something?
Thank you so much. My region, I'm from Peru, and this is the first time that, as a researcher from Peru, we came here, and I'm kind of excited to meet all these people, and also link my voice, because as a gay man in Peru, we don't have a gender politic. So most of the time, our voices is not present. And I talk about a lot of vulnerable groups as well, women in the diversity, decent people, trans people, immigrants. But in this case, I'm here, and I'm so proud to be here. I all the time said as a Latin American who has a degree, we are the 3% of people in the globe. So just being here, standing here, for me is extremely important. I'm so proud of me. I've been here with a lot of scare about my English. I'm being here a lot of scared about mispronouncing something. And I'm still shaking because I'm gonna have my picture, my poster picture in a few hours. And yeah, and I think like it's extremely important to see and watch so much love, and love is the strongest force in this planet. So coming here and watch all these people talking me about love, and I try to do all the time that with my partners, with my friends, with my husband, with my best friends, with my chosen family in Peru, with my Spanish family here in this part of Europe as well. So, coming here, it makes me feel less alone, because finally I find more people who is interested in the planet. When I initiate my master's degree, I'm choosing oil spills and how oil spills develop mental disorders. It was kind of hard because the evidence is so mixed, but it's necessary to put those stories into the light because regions as Asia, Africa, Latin America, who were so exploited in oil spills areas and geography, we still silence into the science. So my global scoping review, this is the first time we are making this, and we are so proud to just being here, stand up here, and let my voice, because I said to the first, from all this long speech, most of the time our voices it doesn't hear around the world. So my speech today is like, thank you so much. First of all, thanks me, because I got the guts to come here, even though I was, thank you. Even though I was like yesterday crying in my room, because I was so emotional to look at all my Latin American partners and also my Italian friends that I made it. And I was like shaking, and I need to, that moment for me, to appreciate all of these days. So thank you all. Thank you for the beautiful plenary all those days, but most important, to the plenary in the morning. It was so inspirational. And I text my husband right now, and I'm telling him, I feel less alone now. Thank you so much, Planetary Health Alliance. Thank you so much. And I just want to say, like, we made the first day, the pre-event conference to this little tire from communicational for non-scientist people. And we met there. And that day I was like so tired and my English was so bad. Thanks for that. I have a really great inspiration from storytelling. If you guys are really interested about my storytelling, I'm gonna have there a few hours. It's just 3 minutes about a beautiful story about resuming my thesis degree with my team in Peru, in Latin America. I expect that you really like it. If you don't, that's okay as well. The most important thing is, for me, is being here and our power as a LGBTQ people is just stand here sharing our voice, because this is my power. My power is being here alive. And I learned that in ballroom culture in Peru, that exists still a little group of people who were struggling with their bodies, with their faces, with the long hairs, and all the dysphoria that we sometimes had just for being different. And thank you. And the last is science needs more diversity. Because in diversity is the secret for human existence. Thank you.
Okay.
So
Very
if you don't
impressive.
sign up for the communications working group, I will be very upset. Okay? Good.
I'll try to stick a bit more to, well, I'm very impressed. I'm not quite sure what to say about it. Let me stick to business. I come from the Netherlands. We have a particular situation in our country. The climate debate is almost silence. We have a very difficult political situation also. So I'm very afraid that in the next cabinet period, the next governmental period, climate as a topic will not be main stage. So the timing to do something about it, try to do something about it with like-minded people is, I think, now. That's why I would offer to do my best to find people in the Netherlands who will help to do the rolling out of media training. This is the first week that I was present in any activity of this nice alliance, this great alliance. Also, you're working together with Planetary Boundaries, with Johan Rockström from Potsdam and with Tim Linton for the tipping points from Exeter, is excellent timing. So the toolbox is there, and now it's how do we use it smartly and get the results fast, because we really have to act. So I would like to take part in that, and let's see if I can find other people in the Netherlands to do the same thing.
Okay, I'm from the bad guy nation at the moment. So I just know there are a lot of people here from the States, and there's a lot of good stuff that's still trying to come up. And this framework, it's like it gives my heart joy, because it's so integral. In my whole life, I've been trying, how do we connect all the dots? How do we get a really overarching framework that addresses the collective problem that we have, because it's not in one place or another, or one thing or another. It's this whole integral framework. And I just hope that the people in the States give this a vision and a view, so that people realize that, because so many people are isolated in their individual places and don't know where to plug in. And there are so many different good seeds that are trying to come up, and we need the mycelium, this integral network, so that people can feed each other from the ground up, and that people know there is a vision. And I know this is just sprouting. The mycelium is there, the underground network, and we need to let people know it exists in all these different places, and maybe even connecting with like the science communication branches at different universities. I know UC Santa Cruz has a science communication department, and different places do, that they know that that planetary health exists and that people can approach it. There are just so many places for them to know, to get the spark and figure out how to network all these, that we create the umbrella for it. So the mycelium and the umbrella can give people a way to reach out and find that the unity exists, that the vision is there. I'm really grateful to all of you, and to see that it exists like this. Thank you.
Thank you, ma'am.
I'll make it quick. So I'm Kennedy Michael from Malaysia, on the working group with Oliver Communications. So I'm going to repeat what everyone has repeated. Please, we need more people to join the communications working group. Just come in once at least, and then find out what the climate is like and see how you can contribute. I just want to add, it's really interesting. I'm also partners with the Ocean Cleanup, which is a Netherlands-based solutions provider, and I'm looking at all the solutions that we can transport to Malaysia as we face water and flood issues. Now, these stories need to be told, and it needs to be told by communicators. I also wanted to talk about what was mentioned earlier. My other colleagues in the working group, we finally meet in person. We've been talking online for a long time. Just this one thing about the Malaysian plan. And so we came to see it quite late. We've been in consultations with a lot of them. We didn't get to see the whole thing. I have to go back to see it. But one of the good things that have come out of it is that we actually have a plan. And as my dad always says, if you have a plan, you can change the plan, you can pivot, you can adapt. But if you don't have a plan, it means you haven't put out the work. And I work at the forefront of climate issues in Malaysia, and it's really important that we start somewhere. It doesn't have to be perfect. We're going to go back and rip into it, but I don't expect a backlash, because one of the things that we do in the work that we do is that if you're going to complain, give us a solution. If you don't have a solution,
Thank you. Thanks to this working group for all the lifting you've done so far. I just wanted to reflect on our panel this morning and the powerful message that we heard. And then just asking us whether we can use, a communication strategy to continue to amplify that message and ensure that planetary health remains Earth-centered. And then related to that, with AI, a concern that I have is it was built and has, to this point, for the most part, been trained by colonial minds. So, at the point when AI becomes smarter than us, what's stopping it from, perpetuating those, yes. So that was one message. On a more practical note, I was just thinking about this kind of, continuing to roll this out and expand it, if maybe leveraging the regional hubs might be a way of, kind of expanding to other regions. And also just a question about the training. I'm really interested in this training because I'm actually in a training right now. It's targeting health professionals and kind of like, can we now give health professionals sort of journalism skills? And so I wonder if the training that you've done can be sort of adapted like that. And like, I think we kind of need journalists to know about planetary health, but also like health professionals to be able to communicate better. And so that was just a question.
Can I quickly respond to that? Yes, Internews has been training health professionals, scientists, faith leaders to communicate better with media and also to produce social media content and do little articles and things. And the other thing that we've discovered really fetches results and builds trust and two-way relationships is holding these media science cafes. We've done them all over Sierra Leone, sub-Saharan African countries, also in India, where we bring scientists, researchers and health professionals, nurses and so on together with journalists in the same room so that it's non-threatening. It's not that you're up there on a podium talking down to journalists at a press conference and it's far more friendly and you share each other's barriers and the academicians or the health professionals understand what a journalist's deadline is like. And also the health professionals learn that the way to build relationships with journalists is not inviting them for a press conference just on World Blood Donation Day and then using them, but being available to them if they have a question. When they have a 6 a.m. deadline and someone calls you at the clinic at 5, just give them 2 minutes on the phone to explain what something means, even if you're not part of the story, and that's how you build the relationship with journalists. So there's got to be more of a giving and less of expectations, and then the relationships really grow. That's one thing. The other thing I very quickly wanted to add on is, I see there are HIV veterans in the room, and if you think about it, there was just this massive global organization to confront and address a single disease, right? But a disease that was completely invisible to start with, and which just manifested itself as a range of other diseases. So we have lots of parallels. And if there could be a joint United Nations program just to confront a single disease, bringing in diverse expertise across, gender, the food and agriculture program, and so many other things, just to confront one disease, it can be done. The second major thing I think that we have to learn from the global response to HIV is that it was a vehicle to realize human rights. So you saw a large number of people of diverse sexual orientation on the streets, not because they had HIV, but because AIDS was that sort of, it was that release valve that really brought out every one of the other issues that prevented them from accessing services or being part of mainstream conversations or being in the papers in a respectful, dignified way and so on. So that was an avenue for them to enter the conversation, direct it, and create now today public health services which are far more open, compassionate, sensitive, and responsive. So I think we have a lot to learn from communities that are not part of the planetary health conversation right now. And if you think about who's vulnerable to planetary health changes, it's every one of these marginalized communities that are out of. So I think it's really a very strong case to bring them in and learn from them and you know, it's to help them realize their aspirations. It's their ground that's going away from under their feet. It's their water resources that are drying up. And I think that can mobilize action on a global scale far more than any Lancet Planetary editorial ever can. I don't know if Manju wants to add anything to it. Yeah.
I think we have to, unfortunately, we need to vacate the room because there's something coming up. Could you all please take your phones out, open the notes page, and write my email address? Those, just mine, and we'll filter. So if you want to join the AI working group or the communications working group, send me an email, and I will filter it to Cornelia rather than asking for 2 emails. So it's OLIVERH at the squiggly at thing, sunway.edu.my. MY, as in Malaysia. Yeah, Malaysia. So I'll do that again. OLIVER, Oliver H. Hall, Oliver H. at sunway.edu.my. And I will hopefully hear emails pinging into my inbox in the next couple of minutes. Nazia, back to you to close.
Thank you. Thank you, everyone. And really appreciated that you stayed here past 5 minutes of lunching time. So yes, happy lunch. And thank you so much to all our speakers. See you around. Thank you.